Thank you. My next question is for the medical cannabis industry representative here today. Some people have voiced concerns that legalizing recreational cannabis will result in the reduction of available medical cannabis. Others have said that allowing more producers will be benefit for medical users. What benefits or medical users do you see coming from this legislation?
Well, I think the first benefit, hopefully, and we've heard some messaging from the federal government, this will give an opportunity to reconsider the taxation of medical cannabis. And right now, medical cannabis patients pay provincial tax as well as federal tax. And we feel that that's inconsistent with the current use of medicines in Canada. So that'd be the first benefit. I think the second benefit is going to be a destigmatization. We feel that the legalization of recreational use of cannabis will actually allow the medical community to consider the medical use more fully and more comprehensively. And the quicker we can get it in pharmacies, the more normalized the use of medical cannabis will seem. So we actually think that these steps forward to legalize recreational adult use will help in the normalization or destigmatization of medical cannabis as well. And also we're seeing a lot of funding going into studying recreational use right now that I think will be beneficial in terms of looking at long-term patterns of use for medical cannabis as well. We heard from Dr. Ware today about some of the research he's hoping to do. I'm involved in a number of research projects, clinical trials on PTSD and examinations on cannabis as substitution for opioids. And I think that that research will help us better understand, once again, the potential harms associated with cannabis, but also the potential benefits of legalizing adult recreational use.
Oh, thank you.
Thank you.
Following task force recommendation, the government will maintain the medical cannabis regime for people who have authorization from the medical professionals. The task force also recommended that this be reviewed in 5 years of new law, which the government intend to do. How will medical patient benefit by maintaining separate access for their use?
Well, I think that there are certain types and preparations of cannabis, and we've heard from our friend Mr. Jones about the benefits of high CBD cannabis strains. CBD is not impairing. It's not something that we would expect recreational users to typically be seeking out. If you've heard about the medical use of cannabis in the treatment of pediatric epilepsy, those are all high CBD preparations, and in fact, Tilray, my employer, is involved in a clinical trial at sick kids looking at high CBD extract products as a treatment for pediatric epilepsy. So those products, without maintaining a strong and robust medical cannabis program, will likely disappear from the recreational program because they're simply not impairing. They won't get you high. So there will be not a lot of motivation for that production of those. So protecting products like that, as well as the use of capsules, orally ingested products, in order to discourage the smoking of cannabis, I think is going to be a very important part of what we can expect in the medical system. I do want to also suggest that you asked a very important question. Will patients still be able to access medical cannabis when recreation comes around? And there are certainly some companies that are clearly hedging their bets more on recreational cannabis and that are advertising or marketing themselves even today as more as recreational cannabis companies. But there are those of us who are determined and focused on the medical cannabis patient, putting money and research into medical cannabis. And we'll continue to try and meet the needs of patients across Canada as best as possible through legalization.